Welcome to the Health and Piano podcast. I'm very honoured to have a special guest with us, Shirley. Would you like to just introduce yourself, Shirley, and just say a bit about what you do?
Absolutely. Thank you very much for having me, Declan. My name is Shirley D'Sa. I'm a professor of haematology at University College Hospital in London, UK. And I met Declan through that route. Declan, you can maybe take a bit more about that.
Yes, so I was diagnosed with Waldenstrom's macroglobulinemia, which has taken me about a year to say. I'm probably still not saying it correctly, but otherwise known as WM, which is a type of lymphoma cancer. And so I was diagnosed about a year ago, and it was all very sudden and very new. And I went along, oh, I say it's probably 18 months ago I was diagnosed. I went along to a conference nearly a year ago, I suppose, in London. Um, and I met Shirley at the conference, and I was blown away really with the amount of information and the also meeting people socially, other patients, and I found that very useful. But really was blown away with how the treatments have evolved over recent years and how they're much, much better now. The quality of life of patients as well has really come on. So I was really encouraged. I think I went into the conference not knowing whether it would be doom and gloom and there'd be a lot of ill people and I'd come out of it feeling really down, but it was absolutely the opposite.
Yeah. Now, I'm very glad about that. For the uninitiated, first of all, hematology is the branch of medicine that deals with blood disorders. And within that, there are many subcomponents of blood which can malfunction. And I studied hematology at University College Hospital and then have remained there as a specialist. And I ended up specializing in this very rare entity, which you did prescribe correctly, Waldenstrom macroglobulinemia, which is named after a physician from Sweden who kind of made some very early observations down a microscope, actually, about the behavior of blood cells and proteins. And the name of the disease has stuck, although it's a bit of a mouthful. The good thing about it is, although it's a very rare disease, there's been an amazing community of both physicians and patients around the world who have focused in on it in a way that is with the aim of improving outcomes. When I say rare, it's about 5 or 8 per million population. And any rare disease suffers from struggling to get attention because although there are many new treatments available for all diseases, including cancers, the conduct of trials and so forth becomes quite difficult when there's a rare disease because it doesn't quite stick out and getting people's attention is often difficult. So throughout my career, and it's quite a long career, I've been a consultant for more than 20 years now, I have seen remarkable changes in this area across the board, from diagnostics to terminology to a gathering of a community of physicians to patient empowerment through organizations such as the International WM Foundation and in the UK, the WM UK. It's been fantastic, and I've been swept away along myself by the enthusiasm. But that is being backed up by a lot of scientific advancement. And that's been, I think, curated by a group of very dedicated physicians, both in the US and in Europe, and actually broadening out to other parts of the world as well, which is super important. It is actually a very positive spot to be in. What we can't do is change what happens to us. It just happens. And the question then is how to manage, how to cope, how to get the resource you need to manage your living with a condition like this, which you can live with for many years, actually. Not everyone needs treatment to start with. Some people are watched for many years and may never need treatment. Others need treatment and respond and need further treatment and so on. And I think when I met Declan, and I was very interested to hear about his line of work because I always take an interest in the person because I know that what people do and how they live it's part of them, it shapes them. And I was actually super interested to hear about the kind of service he offers to people who are also struggling. and we got chatting about things. And I guess that's why I'm here. So yeah, that's a backdrop for where I'm coming from.
Yeah. So I found it in the same way that I found the conference really uplifting in a intangible type of way, as well as the information, which I found really uplifting. But I also found that just chatting to other patients and making friends there had this intangible feeling that I walked out of there on a high. And I think it was because I walked into the building feeling this kind of isolation that I've got this strange thing and I don't know any other patient that has it. And
Mm,
I don't know what my future's going to be like. And it was all this not knowing. And even though there's still, nobody can really tell what's going to happen in the future, because you might be in a car accident tomorrow, or, other things can happen, which we don't
yeah.
control. But just knowing that there are other people, I think we're social beings, and I think having a social interactions automatically lifts your spirits. And I
Mm,
definitely found that with the conference. And then since I've been involved with the Zoom meetings and groups and other meetups, and
mm,
it was only when I got ill that I sort of realized the power of that, that our students had been telling me this for years. So we got a few thousand students aged mainly 60 to 95. And my primary thing was to teach them piano in an accessible way. So
yeah.
I just invented this way that, based on how I play by ear, how I can instantly hear a tune and know how to play it. But I realized that if I could write this down in a teachable, simple manner, then people that can't learn by the traditional way would be able to access music. So that was all I was trying to do, is make music more accessible. But then I heard these people were saying that they had lost their partners, they were in
Mm,
grief, they had cancer treatments, lots of different things were saying that music has transformed their life,
mm,
and also being in connection with other students then. So we purposely then put things in place like a buddy scheme so people can buddy up with
mhm,
one or several people. And this has really
mm,
transformed their experience, not only of music, but they're saying it's transformed their lives. And so I was very
mm,
interested, especially after I then experienced a bit of this myself at the conference, is
yeah.
how we can get more interaction, more social connections between
Mm.
people.
100%. 100%. I'm a formally trained physician, but I've always had an interest in the holistic approach because my feeling is that we're whole people and our physiology may go wrong at times. And as doctors, healthcare professionals, we try and put that right using therapies, some of which are actually pretty powerful and one could even say toxic, but needs must. So we have to do what we have to do. But we it's important to not neglect the other facet of one's being, which is your spiritual being. I don't necessarily mean religious, but just the fact that we are whole people, we have all our senses, they play a big impact on us. And we are social beings, 100%. And I can say as for myself that even if I'm sometimes feeling a bit kind of busy, tired, etc., I find nothing more invigorating than actually coming in and meeting people at work, in clinic, and so on. I always get uplifted by that because it is dealing with other human beings. And if I can possibly help them, that is what I want to do. The healthcare system is quite difficult to navigate. And I think that adds to the stress. And I know from my own experience of when family members have been unwell, it is challenging. It is very challenging. And I think that is why I'm so much in favor of this community approach to things, however it may take, whatever form it may take. I think music is amazing. It's a wonderful way of bringing people together. I know it brings me great solace. Again, if I'm on my commute and I feel, well, I'll put on my playlist, I just end up, having an internal dance or, hum along, trying not to look a bit foolish on the tube. But I come away feeling quite often so uplifted. I also think about the musicians. I'm always marveling at the kind of how they put it together, the creativity, whether it's Afrobeat or rap. or even a classical piece where what brain power has gone into coming up with an amazing piece of music. I mean, I couldn't conceive of it. So I find that very enriching in at many levels within myself. And sometimes you need to be melancholic, and I quite like sometimes to listen to very peaceful, calming music, and other times it's more an exploration of different cultures. Now, London is a very multicultural city, and so I come across patients who come from all kinds of backgrounds, as well as staff. And I appreciate that very much. And so I'm also curious about the music that people have are exposed to, what their origin story is, the soundtrack of their lives, if you like. So I just think it all works really well. And I think it's important to include all of that into one's journey of coping with things. I'm just really fascinated by what you're doing, Declan.
Yeah, thanks. Yeah. I'm mainly about teaching people how to play music
Mm,
and all the things that come from that composing, writing, and all these things and playing by ear can be relatively simple if you know how to unlock the patterns that are in there. As you say, music can seem very, very complicated on the outside. There's lots
mm,
of notes. And if you ever look at a musical score, a sheet of music with all these
mm.
dots all over it, it is, there's a lot of dots and it gets complicated. But
Yeah.
there's patterns within that that are incredibly simple. And that's my personal thing. I mean, I spent decades going from the classical side as a child, and it's grind. Well, for me it was anyway. It was grinding through year after year after year to try to get to a certain level. But then I discovered the Beatles music with friends at school, and we formed a band at school, and that was a whole different type of music. That's where you
Mm,
more playing by ear then, or just playing from a few chords, and then went on
mm,
to write music and this type of thing. And I think many things can be demystified if you know how to spot the patterns in things.
mm,
But one of the things that I really encourage our students to do is to what I call doodle, but it's improvising and leading
mm,
to composing. So most people might think, well, you might have to spend years in college to be able to compose. But anybody, I mean, I've taught children of 4 and special needs
mm,
people and all people across the whole spectrum. Anybody can start to compose within a few minutes if you just are shown a couple of patterns and you take off your own internal constraints. Because most of what stops us is our belief that either music is complicated or if I play a wrong note, I'm going to feel silly. Whereas if you
mm,
are shown a way of, here's a pattern with your left hand, play that, now play any
mm.
of the white notes here, and it'll sound pretty okay. Then really? And then people have a go. It's amazing, amazing. But the whole purpose for me isn't to write something that then goes on to be played by a philharmonic orchestra and win awards.
Mm,
It's simply to play music which lifts your own spirit. Dr. Deeks that I was talking to, he had such a simple take on it that even if you don't want to learn how to play or you haven't yet learned how to play music, if you simply think about what songs make you smile, what songs bring back a memory from the past, and put them on a playlist, and just sit down and listen to the song with nothing else. Because you're saying usually we listen to music if we're running, walking, some food,
true.
traveling, we're usually doing something and music is then our background, which is obviously nothing wrong with
Mm,
that at all. But his
mm,
point was if we just listen to the music that we've already chosen moves us, but a bit like a meditation, I suppose, that you just
mm,
focus on that, even just for 3 minutes or so, that can really transform how you feel. So I'm very interested in all these aspects of just making
mm,
music or the power of music to improve wellness, just to make it more
mm,
accessible, whether it's playing an instrument or just being aware that, okay, if I stop doing these other activities and just give 3 minutes to this song that I've chosen because it moves me, that can really enhance how you feel.
I agree. And I think it's interesting. As you were speaking, I was thinking of the pattern recognition thing. I mean, that very much applies to medicine as well. You start off with a rigorous training so that you understand where all the notes are, etc., etc. But as time goes on, you internalize a lot of that. But you spend your life pattern recognizing when patients come to you with certain condition or symptoms or whatever, and you sort of build on that. And I think so that is something that I think all humans like. It's comforting when you do find patterns and it helps things to make sense. But I think also, medicine has become very, very complicated. And when people are facing a condition that is thrust upon them, and then are also faced with a whole new vocabulary sometimes, as you mentioned, Waldenstrom macroglobulinemia. Along with that comes a lot of other words that you have to learn so that you can understand what is happening to you, why things are being done, what they mean, whether your condition is stable, etc. I think all of that does mean it's very important, I think, to think of other ways of relaxing and connecting with yourself. I personally am a great believer of physical aspects of keeping well, such as yoga and exercise, nothing too vigorous in my case, but the things that are within our power. And I think that kind of speaks to what you do as well. It's something when you have a condition, and because medicine is so complex, I think it's easy to feel that things are just happening to you and you're a recipient of all kinds of stuff. But the things that as an individual you do still have power over is you can choose to take time to think and reflect or meditate or do some yoga or whatever it is that sort of helps you, whether it's going for a walk, being in nature. Everyone talks about it, but I think few of us find time to actually do that. I think music comes into it as well. That is something that we, as physicians, we do work with other practitioners to call upon these methods so that people feel a bit more empowered to do things for themselves. I mean, for example, there's a wonderful lady called Anne Grace who works with the IWMF and has regular sessions of chair yoga and other practices, which she conducts via Zoom. And I know for a fact that people find that very helpful, and even small bits of exercise, little actions can make a big deal over time, even if you don't feel it from day to day. But usually, even a small piece of physical activity will get your endorphins going. It'll just uplift your spirits, but it'll also give you some muscular exercise. If you don't use it, you do lose it. So these are things that I think can easily get forgotten in a busy medical world as a patient and as a doctor. And so I think being mindful of these other factors where you can play a role in your own life and your own health is to be really encouraged. And I'm a huge fan of that.
And have you got any other tips for, say, if somebody is newly diagnosed and they're going to see their consultant? Have you got any tips
Mm.
that would help them get the most out of a consultancy meeting?
Yeah, for sure. I mean, we've actually talked about this as joint patient initiatives. I think it's very helpful to go with someone who can help be your sort of second brain and maybe make notes. I've read a lot about the fact that when people first go and see someone and hear about a diagnosis, they may hear the word cancer and then they freeze. And so they may look as though they're listening, but I think a lot of it is just gone. So it's good to go with someone. It's good to there's a lot of material available. One word of warning, though, is that if you go down the wrong path, you may end up with being misinformed. And the rate of change of information on the internet is just breathtaking. And of course, AI has now joined the whole situation. It's really useful and important to go to reputable sources. Now, ideally, your physician or your nurse or whatever should be able to guide you. There are big blanket organizations. So, for example, for people who have lymphoma, there is Macmillan, there's Lymphoma Action. There are some well known organizations, charities, who curate and prepare material with professional input. But sometimes with someone who has a very rare disease, maybe it's not quite enough. So going to look for reputable information from sources which speak for that disease area with input by people who are experienced, who are experts, is important. So I think if you do a Google search, for example, you may end up with, I don't think any of us dictate what comes first, but you often end up with something that isn't there. But just be a little mindful of what you click on and ask, if necessary, go to someone like Macmillan to just double check, where can I get information? Ask your healthcare provider, your doctor. But yeah, so try and find the right information. Bear in mind that information is often very generalized and it may not be specific for your condition. There may be a lot of sort of scary sounding information there that may not apply. I think it's really important to try and avoid, if possible, worrying about things that may never apply to you, because otherwise that's a lot of wasted emotional energy. I think it's very difficult to avoid that. But if you look at things with someone's input, and as I say, double check with your consultant. And the other thing I would say is don't be afraid to ask for a second opinion, because especially if you have a rare condition, I think people do their best in all hospitals, but sometimes people with a rare disease, their consultant may not have seen many of those patients. And so you have the right to say, look, can I get a second opinion? And there are a number of centres around the UK actually where there are WM specialists. At the present time, probably a good place to look is the International WM Foundation website. I believe WM UK also has connections to different centres where there's a lot of experience. So I think seek things out. And finally, I guess if you feel that your needs haven't been met, don't give up. Dig deeper and try and find some help and advice, possibly via, as I say, a consultation with an expert. Don't be alone, because there is help out there. And what it does is it's good for everyone if you feel more settled, more able to live your life as you want to live it. It's good for you, it's good for your family, it's good for society. So it's try and get the help you need. And there are resources out there specifically for the condition I treat, but also a wealth of resources for many other diseases as well.
Great. Just talking about patterns, which you touched on earlier, have you seen any patterns in patients who have better outcomes than patients who don't? So what I'm wondering is, there might be no connection, but I'm wondering whether there would be any state of mind or attitude or lifestyle that would mean that a person is more likely to have a better outcome than otherwise. Is there any
Mm.
patterns that you've seen in that area?
Yeah, it's always difficult when you do things in an anecdotal way. But yes, I mean, I've been in the WM world for 20 plus years. So, and I have been aware of, I guess, the fact that I'm pretty certain that stress is unhelpful. The thing is, none of us can easily get away from stress, whether or not we have WM. So that is a project of its own. But I've been reading about the fact that stress does get certain physiological processes going, which are there for a good reason, which is to protect us. But it kind of applies more to a time when we had to run away from a saber-toothed tiger rather than the kind of stress we have now, which is more or less continuous. It's like simmering within us. And that does have consequences for the way the body functions, because you tend to have more stress hormones around. This tends to encourage a sort of a more inflammatory state. So it's very, very difficult to tease this out in any one individual. But I think the the stress aspect, I think, is there, although stress is different things to different people. Some people need stress to perform and others less so. But in a situation of not being well, I think that kind of stress is probably unhelpful, but very difficult to get rid of. And this is why finding strategies to reduce your stress, to tap into what's called your parasympathetic system, the rest and digest side of things, I think is very, very important if you can. The other thing, I mean, of course, there are biological things within a disease that predict for different outcomes. And that is, of course, that is something one should leave to the medics, because that's what we're doing through our research to try and understand, if someone has this mutation or that mutation or this marker, how should we adapt treatment to try and nullify that risk? So that is definitely underway within medical practice and research. But in terms of oneself, I think other things is to actually, it sounds so basic, but it is to keep active and exercise, to eat sensibly, moderate, just live in moderation. I think, we should all do that, of course, but I think perhaps more so if you have an underlying condition. And also, I think just to kind of keep away from the temptation of following through on amazing promises on the internet, because quite often there are things that come up claiming all sorts of things. And my general word of advice is the more expensive it is, the less likely it's to be effective, because there are ulterior motives there. I'm not saying supplements, etc., don't work, but I think any supplement that is taken in massive doses is not good for the body. It's not physiologically helpful. So it's just sort of those general bits of advice. And one thing I would throw out is, for example, vitamin D supplements are generally good for everyone who lives in the Northern Hemisphere. Um, it's something I would recommend to most people. Vitamin D has a lot of properties that are probably much beyond bone health. So that's I think a good thing. And also not to ignore other health aspects, just keeping fit, getting your checkups, if you're a woman of a certain age, mammograms, if, blood pressure, diabetes, all that stuff. Because at the end of the day, even if you have a disease, you're still part of, it's within a body that has all the different organs. And the better you are physiologically, the fitter you are, the better you are able to tolerate whatever has to come your way. So I think that's where I come back to the holistic approach.
Yeah, that's interesting about the stress thing. I'm interested in that, and I've not really done much meditation myself, but every time I do, or I've got a friend that does sound baths. So you
Oh
go
yeah.
with people, you lie. There's an old church that he uses, and the sound reverberates around, and he's got all these different instruments and sound bowls and
Oh
chimes
yes.
and
Mm.
drums. But it's amazing. Just the feeling is just amazing, and you come out of there so relaxed.
Mm.
So I'm
Mm.
interested in exploring that side as well because it's just if anything if it's just a pleasant experience, but I'm
Mhm.
interested in whether there's more from a therapeutic point of view.
Mm. I think there's the evidence for these things is you won't really find it in scientific journals, but if we think about human evolution, a lot of these practices have been present in many, many cultures and traditions. And I think they make a lot of sense because they're very simple. It is a way of connecting with your senses in a gentle way, not a harsh way. I think a lot of modern living there's a lot of noise and activity, and it can be very overwhelming. So again, I don't have evidence for this, but I personally also enjoy that very much. The sound of a gong, or it sort of hits you at a level that can't help but relax you. So, it may not change your whole life, but in that moment, I think it can make you feel a lot calmer. And we just need more calmness in our lives, I think. So, whichever way you do it, I think it can only help.
Absolutely, yeah. And just on a slightly different note but linked, favorite songs. So any songs
Uh,
pop to mind?
uh, so many actually. So I grew up in East Africa, and so my sort of the soundtrack of my youth was very mixed actually, because we lived in an expatriate community. And I come from Goa in India, where there was again a mix of a lot of Western sort of music, and my aunts and uncles and everybody. There's a lot of like ballroom dancing, and even things like the cha-cha-cha rock and roll in our community get together. So that was a soundtrack in my mind as well. So I love all that. I do love, the rock and roll group the guys who did all that. I also like, Simon and Garfunkel. That was something I grew up with, perhaps a bit more than the Beatles personally, because I just happen to hear them more, and I love their lyrics. I think they're so meaningful, and the musicality. I've got sons who love Afrobeat and various rappers. I love all kinds of music. So whether, it's Kendrick Lamar or Chopin's Waltz in C flat minor, all this stuff, it means something to me. And I also have been digging into some African music, including from West Africa. It's just, there's so much to learn from music, and people who put it together are so creative. And I really, really admire that, because I don't think of myself as a very creative person. I guess I'm more kind of perhaps left-brained or whatever. But I really admire those who are creative and artistic. But I do have the capacity to enjoy it. So I've got an open. My playlist grows every day, and I have to say, when you go on to sort of the online availability of songs, you can find pretty much everything, which I think is one of the good things about technological advancement, which I appreciate.
Yes, absolutely. Yeah. Well, thanks so much for taking the time, because I know you're super busy. I really appreciate that.
Been really nice talking to you, Declan. Thank you so much for inviting me.
For more information on the Health and Piano podcasts and to get some free tips on learning piano later in life, go to deckplay.com/free.